Hello and welcome to another video from me, this tutor, and this time I'll be talking you through the key content about surgery in the 1800s. Okay, so I suggest you have a watch through the video a few times to learn all the key knowledge you need to know about surgery in the 1800s. Then take a look at my revision guides and some of my exam question videos to test your knowledge and see if you can gain full marks in the answers. Okay, so let's learn some of the key information about surgery in the 1800s. Of surgery in the Industrial Revolution by thinking about what surgery was like at the end of the 1800s. So surgery and Renaissance, we still had a problem with bleeding. So Pare's crow's beak had stopped the bleeding and slowed the bleeding during an amputation, but blood loss was still a problem and they didn't know how to solve it. They didn't know how to replace blood in the body. Operations were still very painful. There was still very much a cut it off, cut it out philosophy, and surgeons were good if they were fast. Infection was a big problem, so surgery was still dirty and unclean, dirty tools, dirty table, dirty clothes, and often a surgeon was considered good if they had lots of blood and dirt on them. They had been busy, if that was the case. Surgery was obviously very painful. They did not have pain relief. Best pain relief was laudanum, but the main problem was that patients were still awake. You could not do complex surgery on a person who was awake. So our first key figure is John Hunter. Now this is obviously at the end of the 1700s, so not quite in our 1800s period, but end of the 1700s, and he's still very much this cut it off, cut it out person. So he once removed a 144-pound tumour, for example. He experimented to test ideas, even experimented on himself to try and find a difference between gonorrhea and syphilis, but it went wrong. He accidentally gave himself both illnesses. He did make some progress in the late 1700s. He did lots of experiments on dissecting animals and stuffing them. This is called taxonomy. And he also got bodies from grave robbers, etc., to study dissection. The Anatomy Act that came in the late 1700s allowed him to legally look at bodies of criminals and find out more about how the body worked. Then we're on to the problem of solving pain. Now, it's right at the end of the 1700s, going into the 1800s. Humphrey Davy discovers laughing gas, or nitrous oxide, and realises that it has a pain-relieving property. This was experimented on in the 1800s, and Horace Wells attempted it in a public demonstration in 1845. But the patient, yes, although they were laughing and a bit jovial, was not really too keen to have the extensive operation on them. And again, the idea of being asleep was much more the idea they wanted. So we have some important things developing. We have ether being discovered by Dr. Warren in 1846, and he used this to knock a patient out at Harvard to remove a neck tumour. Later in the year, an operation was attempted by J.R. Liston using ether to amputate a leg in Britain, and it was a success. However, ether was a bit of a problem. People would cough, it irritated the throat, and people would cough. It was very flammable. So in an era where we still had candlelit surgeries and gas lamps, having an explosive substance was not ideal. And scientists had been experimenting making new various compounds. That's how ether was discovered. But also chloroform had been made. And James Simpson and some of his surgery friends decided to be experimenting with some chemicals to see if any of them would knock them out. And luckily enough, they came across chloroform and it knocked them out. Luckily with no side effects. So Simpson went on to try and use this and use it as an anaesthetic. And he made a big publicity of how great it was in knocking out the patients and therefore being able to perform surgery. There was some opposition though. Religious people felt that pain was a sign from God. Think about Genesis in the Bible. Women were given birthing pains, etc. from God. Surgeons who were fast suddenly started to lose business because suddenly it was not about how fast you are, but how good you were. Operations that were longer now actually did lead to more death because blood loss and infection was still a problem. You're digging around inside the body with dirty tools and there's lots of bleeding. The person's more likely to die. And then mysterious deaths developed. So Hannah Greenough being one of the first, people started to die from the operations with chloroform. Now this mystery brings John Snow from public health videos into the equation here, and he is famous for his investigations of cholera, but he also investigated chloroform, and he realised by looking at the deaths, the young, fit and fearful were overdosed and died. young people because they needed more chloroform, the fit people because again they needed more chloroform, and fearful people because they would often hold their breath and then take a big gulp of chloroform. And so he invented the chloroform inhaler in 1850. And this was a great success. Queen Victoria used it for her childbirths of Leopold and Beatrice. And then, with the announcement of Queen Victoria, she thought chloroform was wonderful. All opposition to chloroform ended. Surgery risks were reduced a little bit further with the development of local anaesthetic by Carl Koller later in the 1800s. And this meant that people didn't have to be knocked out, which of course was a little bit dangerous. Simpson was therefore very significant. He, in the long term, developed pain-free surgery, which led to people having to do much more complex ideas like transplants in the 1950s. Important people advocated his ideas. So Queen Victoria, who had childbirth anaesthetics delivered by John Snow, was able to say how wonderful it was. Thousands of operations were used in chloroform, and this meant surgery became pain-free. Today, there was obviously a range of local and general anaesthetics today to help surgery develop, and obviously complex surgery cannot happen without anaesthetics. In fact, today we have anaesthetists who specialise in the role. So in the short term, many people used chloroform, and it was made safe by the chloroform inhaler of John Snow because a realisation happened that people were dying of overdoses. So lots and lots of significance of Simpson. So on then to the second problem. So in the 1800s, we don't just solve pain, we solve infection as well. So the journey starts with Ignaz Semmelweis, a rather unlucky Hungarian doctor who realised that dirty hands were killing people with bedpan fever in the maternity wards. Doctors have been going down, doing autopsies, they're not washing their hands, coming back up, delivering babies, and mothers were dying of infection. He told people to wash their hands, and death rates plummeted, but unfortunately, this was not taken on board by very many people. Semmelweis was sacked for his unpopular methods. However, Florence Nightingale was a bit more successful in getting people to clean and wash hospital wards, and in the Crimean War she was seen as a bit of a heroine, getting clean sheets and cleaning up, dealing with miasma, and generally having a cleaner environment. She believed in miasma, though, so people accepted her ideas. She was also, had friends in high places like the Ministry of War. So again, her ideas were accepted, whereas Semmelweis was not accepted. So the most important person in the 1800s for really developing the idea of antiseptics was Joseph Lister. So communication is an important factor here. He had read Pasteur's germ theory and concluded that perhaps by destroying germs, he could stop infections in the body. So in 1865, he used bandages with carbolic acid on them to treat a boy who had a broken leg with, a very protruding bone and big cuts. Normally this would be an amputation, but he sealed back the bone and sealed up the wound and then wrapped it in carbolic bandages, and the boy's leg survived. There was no infection, and he had made a big breakthrough. So in 1867, Lister then expanded this using a spraying machine to put a mist of carbolic acid around the operating theatre. This reduced infections from 45% down to 16%, therefore showing that he could solve infections using carbolic acid. But people opposed this, believe it or not. So in particular, people were concerned about acid everywhere, hands slipping, hands getting cracks on them as they were doing the surgery. Other surgeons weren't very thorough with what they did with the spraying machines and also cleaning their tools, and so infection still happened and the death rates didn't reduce. Germs had not been linked to disease yet, so people made sort of comments about how germs were not important. One surgeon famously said to his friends to close the door in case one of Lister's germs should come in. So clearly a total lack of understanding. But Alfred Koch had proved that germs cause disease in 1878. Lister's methods developed into aseptic surgery. So rubber gloves developed, metal tables, tools were soon sterilised, all equipment was sterilised, surgeons wore scrubs and hats, so everyone had to be clean. So obviously, Lister was extremely significant. So long-term impact is he began the idea of clean aseptic surgery. Gloves, metal tools, metal tables, etc. All these things happened in the long term to make surgery even better and cleaner and safer, with death rates reducing. In 1870s, he did operations for the Queen. He was trusted to remove an abscess safely using his carbolic acid. So the Queen, again, an advocate of great surgery. Lister's size and scale, so obviously thousands of lives saved. Just his initial figures dropping from 46 to 15% was a big size and scale. But if you put that on the grand scale, thousands and thousands of lives saved. Today we have complex surgery because of Lister and Simpson together. Of course, Lister enables clean surgery, so there's no or very limited deaths from infection. In the short term, his carbolic acid led to aseptic surgery and the end of infections and much cleaner surgery. So very significant person. So obviously lots and lots of factors affecting surgery and the idea of pain or cleanliness. So obviously we've got religion at the top. Religion is a bit of a negative factor. People wanted to keep pain. They thought it's a good thing from God. We've got lots of ideas of experimentation, from Koch discovering how bacteria cause disease, which helps infection, through to Simpson experimenting with chemicals to find chloroform. We've got chance. Lister took a chance when he used carbolic acid to fix the wound of the boy with a broken leg. Technology. Lister used a pump to spray carbolic acid around his operation theatre. Communication. Pastor GM3 helped Lister develop his ideas about aseptic surgery. Queen Victoria for government supported anaesthetics and antiseptics. And communication is really important in a positive way with Pastor GM3, but it's a bit of a negative. Semmelweis wrote a book about hand washing and cleanliness, but it was never accepted by people. So for question 3, similarity is really important to consider as well. And there are lots of similarities. There's the basic ones like high death rate. Take a look at the examples here. In Renaissance, gunshots and cannons caused death rates. In the Industrial Revolution, obviously infections continue to be a problem. Chloroform leads to death rates increasing because of more blood loss, more infections. But the more complex ideas are going to be your factors. Individual genius. We've got Paré inventing the crow's beak and ligature in Renaissance time. We've got individual genius of Lister developing carbolic acid. Communication is important. We've got Vesalius and the fabric of human bodies sharing ideas. We've got Louis Pasteur and germ theory developing great ideas. And chance. Paré took a chance with his herbal oil. Lister took a chance with the boy with broken leg, Jamie Greenlees, and used his carbolic bandages. So lots of similarities used for your exam questions. Sorry, please allow me to interrupt just for a moment to tell you about some of the other services I offer. So look at my website, historytutor.co.uk, to find out more about history tutoring if you want help directly one-to-one, or if you've got a small group of friends who want help, then look me up. Also, if you want more information about my revision guides, they're available on Amazon. They are packed full of revision notes, all the essential facts, organised into revision cards or simple forms you can just look over again and again to revise. Packed full of videos helping you answer the questions. I tutor you through how to answer all the different types of questions. Lots of videos explaining how to do this. Some of them are free on YouTube. Look me up for more videos, but you'll find more and more videos on my revision guides. So take a look. Right, so I hope you found that video useful. Give you lots of facts information about surgery, the key individuals, some of their significance, and you can start thinking about factors and similarities for the questions for the AQA exam. So go away and take a look at my revision guide and my other videos, and that will help you to develop your skills even more. All right, thanks for watching. Bye bye for now.